Okay, let's dive right into something really specific today from the world of veterinary medicine. Canine prostatic cysts. It might sound maybe a bit niche, but the source material you've shared is surprisingly packed with detail. Stuff about how these are found, what causes them, how they're treated.
That's right. We have this concise yet pretty comprehensive piece of research right here. And our goal in this deep dive is really to cut through maybe the more technical language. We want to pull out the essential nuggets, what these cysts actually are, which dogs are typically affected, and crucially, the steps vets take to identify and manage them. And we're sticking strictly to what's in this material, aiming to give you a really clear picture.
So whether you're maybe a dog owner just curious about potential health issues, or perhaps a vet student digging into the specifics, or honestly just someone who loves learning how things work under the hood, stick with us. We're going to guide you through this source material, pull out the most important facts tailored just for you. Let's unpack this.
Okay, kicking things off. The material makes it clear pretty quickly that when we talk about prostatic cysts in dogs, we're not just talking about one single kind of thing, are we?
No, precisely. The research breaks it down. You have diffuse epithelial cystic change, which is often tied to something called benign prostatic hypertrophy, or BPH.
BPH, right.
Think of that as like smaller cystic areas scattered throughout the prostate tissue itself.
Okay, so that's one type, kind of diffuse, spread out.
Then there are retention cysts. Now, the material describes these as distinct fluid-filled cavities. They have their own capsule, but they're inside the prostate tissue.
Inside. Got it. And then distinct from those are paraprostatic cysts. They're similar fluid-filled sacs with capsules, but these form outside the actual prostate tissue.
Ah, okay. So inside the tissue, like the retention cysts, or outside it, the paraprostatic ones.
Exactly.
And the size range mentioned here is pretty wild, from tiny, just a few millimeters, all the way up to over 20 centimeters. That's huge.
It is, yeah. Remarkably large sometimes. The material notes these much larger paraprostatic cysts often pop up in specific spots, usually sort of towards the head and side of the prostate, craniolateral they call it, which can push the bladder out of the way, or sometimes further back in the pelvis.
Okay.
There's even a brief mention that they might be leftovers from embryonal development. Specifically maybe dilated remnants of something called the Wolffian ducts.
Huh. Interesting. Okay, so moving from what they are to the big question of why they happen. The material is quite blunt here. It just says the cause, the pathogenesis, is unknown.
Right. That's one of those sort of surprising insights right off the bat.
Yeah.
Despite everything else we seem to know, the fundamental trigger remains a bit of a mystery. However, there is a fascinating speculation noted in the source.
Oh.
Yeah, they've observed retention cysts showing up in dogs with certain tumors that secrete estrogen. These are called Sertoli cell tumors. And this leads to the idea that maybe high estrogen levels might cause the tiny ducts within the prostate thiacini to dilate.
Okay.
This could be due to something called squamous metaplasia, which is basically where one type of cell lining those ducts changes into a different, maybe tougher type of cell.
Yeah.
Possibly triggered by that excess estrogen.
Ah, okay, that makes sense. Squamous metaplasia, well, like the cells changing form.
Yeah.
So there's a strong suspicion of a hormonal connection then.
Definitely seems that way.
And that aligns perfectly with the risk factors listed right here. Benign prostatic hypertrophy, androgenic hormones like testosterone and estrogenic hormones are all implicated.
Exactly. And that hormonal piece is likely why we see this condition in a specific demographic.
Hmm?
The research points out these cysts primarily affect intact male dogs.
Intact males.
Okay, it's apparently quite rare in castrated males. The typical age range is between 2 and 12 years, with a mean age around 8 years.
Right.
And interestingly, they seem to be more commonly found in larger breeds compared to smaller ones.
So you're painting a picture. An intact, middle-aged, large breed male dog. If a dog like that has one of these cysts, what kind of outward signs might you actually notice?
Well, what the material makes really clear is the signs can be, well, all over the map. The very first thing it lists is asymptomatic.
Nothing. So potentially nothing at all. That's incredible, especially thinking about those giant 20-centimeter ones you mentioned.
Right, completely hidden sometimes. But when signs are present, they can include just general unwellness like lethargy and maybe anorexia, not wanting to eat. If the cyst gets really big, you might actually see abdominal distension, just a swollen belly.
Makes sense.
If it's pressing on the rectum, the dog might strain to defecate, which is called tenesmus. If it presses on the urethra, they might have trouble urinating, dysuria. And the material specifically notes sanguineous urethral discharge, that's bloody discharge from the penis, particularly if BPH, that benign enlargement, is also present.
Wow. So from literally nothing you'd notice
Mm.
to symptoms that could mimic, I don't know, digestive issues, urinary tract infections, very different problems.
Exactly.
That variability must make diagnosing them tricky based on just the signs alone.
Absolutely. And that's precisely why diagnosis requires specific investigation, which kind of moves us into how these cysts are actually identified according to this material.
Okay, so the research goes through ruling out other possibilities, the differential diagnoses. How do vets use this information to sort of zero in on a cyst?
Well, they use findings from their exam and tests. For example, distinguishing simple BPH from cysts often relies on ultrasound findings.
Right.
A prostatic abscess, which is an infection, can look similar on the outside maybe, but it's distinguished using ultrasound and checking for infection, maybe with a semen culture.
Okay.
A really distended bladder could maybe be confused for a cyst, but that's usually ruled out with cystocentesis. That's drawing fluid from the bladder with a needle and imaging.
Uh-huh.
And basically, any other kind of mass felt in that caudal abdominal area is differentiated using imaging techniques.
What about standard lab work, blood tests, CBC, biochemistry, or urinalysis? Do they typically show anything specific?
That's another interesting point. The material states that CBC, biochemistry, and urinalysis usually show no abnormalities.
Really? Often normal.
Often normal, yeah. So they aren't the primary tools for identifying the cyst itself, though obviously they're important for checking the dog's overall health.
Okay, so if standard labs are often normal, what tests are key for pinpointing these cysts then?
Well, examination of prostatic fluid is mentioned. You can collect that either naturally through ejaculation or sometimes through prostatic massage. And that's mainly done to confirm there's no infection going on in the prostate itself.
Right, ruling out infection first.
Then, the material highlights collecting fluid directly from the cyst itself. This is usually done via ultrasound-guided fine needle aspiration or sometimes during surgery. The fluid they typically find is described as sterile, clear, or sanguineous, so clear or maybe blood-tinged, and it's consistent with prostatic fluid. Sometimes it has fibrin in it, which is a clotting protein.
Imaging sounds absolutely crucial here. What specific imaging techniques are detailed in the source?
The research really emphasizes retrograde contrast urethrocytography, followed by prostatic ultrasonography.
That's a mouthful.
It is. But essentially, they use dye injected into the urethra and bladder, followed by x-rays, that's the urethrocytography part, to see the outline and location relative to the urinary tract. Then they follow up with ultrasound. And the ultrasound is vital. It confirms the cyst's presence, its exact location, its internal texture, what they call echotexture, and of course, its size.
And the ultrasound helps tell the types apart too.
Yes. The ultrasound is also key for telling the difference between those retention cysts within the prostate and the paraprostatic cysts outside it.
And I think the source mentions a specific order for doing some of these diagnostic steps.
It does, yeah. It recommends collecting that prostatic fluid we talked about before, doing the fine needle aspiration of the cyst fluid.
Why is that?
Well, the idea is to rule out a bacterial infection in the prostate first, so you don't potentially drag bacteria into a sterile cyst when you put the needle in to aspirate it.
Ah, that's a really smart detail. Makes sense. Okay, and finally on diagnosis, what does the material say about looking at the actual tissue? Like under a microscope, pathology?
Right, the pathologic findings.
Mm.
For those diffuse epithelial cysts, they're typically seen alongside the enlarged prostate tissue, the hypertrophy, and hyperplasia. And as we mentioned earlier, that squamous metaplasia, that change in cell type, may be present.
Okay.
For the retention and paraprostatic cysts, the bigger distinct ones, the material describes them as being lined by either a single layer of prostatic cells or sometimes just fibrous connective tissue, and containing that clear or blood-tinged fluid, maybe with some fibrin.
Okay, wow. That gives us a really detailed picture of the whole diagnostic journey. Now let's shift gears to how these are actually treated. The source says treatment depends on the type of cyst.
It does, yeah.
Yes.
It's not a one-size-fits-all approach.
Yeah.
For the smaller intraprostatic cysts, that's the epithelial changes and the retention cysts, the primary approach is something called prostatic involution.
Involution, meaning making the prostate shrink.
Exactly, making it shrink. The research states this can be achieved either through castration, surgical neutering, or by using a specific medication, a 5-alpha reductase inhibitor called finasteride.
Finasteride, okay. And what about for the larger cysts, the big ones?
Well, large intraprostatic cysts, the ones inside, might be drained first with a needle using ultrasound guidance before starting medication like finasteride just to reduce the immediate size maybe. But the really large retention cysts, and especially those big prostatic cysts, the ones outside, they often require surgery because they're just too big or maybe located awkwardly or they won't respond to medication.
Okay, surgery. What are the surgical options described in the material?
It lists a couple. They can be partially or completely surgically resected, basically, cut out. How much they take depends on how attached the cyst is to surrounding structures. Or another procedure called marsupialization can be done. That's where the cyst is essentially cut open and then stitched to the body wall to create a sort of permanent opening. This allows it to drain continuously, usually for a month or two, while it hopefully shrinks and heals.
Marsupialization, like creating a pouch almost.
Kind of, yeah, an opening for drainage.
And there's a really important caution in here about just draining them without doing anything else, isn't there?
Yes, absolutely. This is a key takeaway from the source.
Yeah.
It emphasizes that simple drainage of the cyst is not recommended.
Why not? Seems like the easiest thing.
Well, because if the cyst capsule, that outer lining, is left behind intact, the cyst is very likely to just fill back up with fluid. You get recurrence. So you really need to either remove the capsule surgically or create that permanent drain via marsupialization.
Got it. Okay, let's talk a bit more about that medication you mentioned, finasteride for the intraprostatic types. What does the research say about how it's used?
Right, finasteride. It's used specifically for the prostatic tissue itself and those diffuse epithelial cysts linked to DPH. The material gives a dosage range, 0.1 to 1 milligram per kilogram of body weight, given by mouth once every 24 hours. And typically this goes on for 2 to 4 months.
And how does it actually work to shrink the prostate? What's the mechanism?
It works by blocking an enzyme, 5-alpha reductase. This enzyme normally converts testosterone into a more potent form called dihydrotestosterone, or DHT. DHT is the main hormone that drives prostate growth, especially in older, intact males. So by blocking its creation, finasteride causes the prostate tissue to involute, or shrink. And an interesting point mentioned is that it does this without apparently adversely affecting the dog's libido or their ability to produce sperm.
That's good to know. Are there any limitations or things to watch out for with finasteride, according to this source?
Yes. The research notes a couple of important things. First, that benign prostatic hypertrophy, the underlying enlargement, often recurs once you stop giving the finasteride therapy. It's not usually a permanent fix unless the dog is also castrated.
Right, it manages it while they're on it.
Exactly. And crucially, those paraprostatic cysts, the ones outside the prostate, do not respond to finasteride treatment. The medication specifically targets the hormonally influenced prostate tissue itself.
That makes sense.
For contraindications or possible drug interactions, the source simply lists NA, not applicable, which suggests that, based on this material at least, it's considered relatively safe in this context without major known issues.
Okay, and finally, after a dog has been treated, whether with medication or surgery, what kind of follow-up does the source material describe?
The follow-up involves monitoring, mainly. Specifically, it mentions imaging assessment of cyst size at 4-week intervals following treatment.
So repeat ultrasounds, basically.
Yeah, likely repeat ultrasounds to see if the treatment, like finasteride, is actually working to shrink the cysts, or to confirm that surgery was successful and they haven't come back. And if marsupialization was the surgery performed, then there's standard postoperative monitoring of that surgical opening, the stoma, to make sure it's healing okay and draining properly.
Right, makes sense.
So, pulling back from all those specifics, we've really navigated the different forms these canine prostatic cysts can take, touched on their potential hormonal ties that estrogen and androgen link. We walked through the quite precise diagnostic steps involving specific tests and imaging that vets use to tell them apart from other issues. And we explored the varied treatment paths, depending on the type of cyst, all drawn directly from the source material you shared.
It really is quite a journey, isn't it? From recognizing maybe a subtle sign, or sometimes, like you said, no sign at all, to going through these specific diagnostic procedures, getting a handle on exactly what's going on, and then figuring out how best to address it. Unpacking the source material definitely clarifies that whole process.
Yeah, and what's particularly, I think, thought-provoking from digging into this research is seeing the profound influence hormones, specifically the estrogen and androgens mentioned here, can have on tissues that aren't strictly reproductive, like the prostate, leading potentially to something as physically significant as a cyst the size of, well, a small football, as you put it earlier.
Yeah.
It really begs the question, doesn't it? How many other seemingly straightforward health issues, maybe in different animals, perhaps even in humans, might have these complex, less obvious hormonal roots that we still don't fully understand just by looking at the symptoms? Something to think about.
That is a fascinating question to ponder. Well, thank you for bringing this really interesting topic to us for a deep dive. We hope this exploration of the source material has given all of you listening some valuable insights. Until the next time you have a stack of information you want to unpack, keep learning.